So I guess we'll get started, hey? I'm really going to read a statement to start with. Good morning, first of all, and thank you so much for coming. It's overwhelming to see such a level of interest. Perhaps not surprising, but very, very encouraging for Médecins, Sans Frontières. The statement I'm going to make, I'm just going to read out a statement that will capture and frame for you exactly what essentially our position is on the mental health services in Nauru. So with me today, I have MSF psychiatrist Dr. Beth O'Connor, who spent 11 months providing mental health consultations to all population groups on Nauru, and Dr. O'Connor, who will talk about her experience of working on the island and the state of mental health provision and the rapid deterioration of mental health that she witnessed, particularly among asylum seekers and the refugee population. Also with us is Dr. Christine Rufana, and she's worked with MSF extensively overseas, including in Lesvos, so another refugee context. And Christine will share her experiences of working on the island and her reflections on the limitations of resources. And then we'll open the floor for questions. So I'd like to start by stating clearly the nature of our work on the island. In November 2017, MSF started free psychological and psychiatric services in the Republic of Nauru. From the very start, and as part of our mutual agreement with the Ministry of Health, mental health support was being offered to everyone living on Nauru in keeping with our one door for all policy. This included services to asylum seekers and refugees and Nauruans. MSF works as an international medical humanitarian organisation with no prejudice or discrimination and in a framework of independence and neutrality. So we were there to serve everyone. Mental health support was provided at the MSF clinic at the Republic of the Nauru Hospital and to people in their homes. MSF also trained and supported staff in several areas of government to boost the capacity to treat psychological and psychiatric disorders on the island. The team also conducted outreach activities to promote the services provided, which included increasing awareness of mental health issues and trying to reduce stigma attached to seeking mental health treatment. On Friday night, our team was told that our services were no longer required and requested that our activities cease within 24 hours. I cannot stress enough that as an international medical humanitarian organisation, MSF strongly condemns the sudden decision of the government of Nauru to abruptly end MSF's provision of desperately needed mental health care for Nauruan, asylum seekers and refugees on the island. And we make no mistake, MSF is extremely concerned for the ongoing mental health of all our patients remaining on the island, including asylum seekers and refugees, who remain in a complete state of hopelessness and despair. MSF calls for the immediate evacuation of all asylum seekers and refugees so that they can complete their resettlement process in a place of safety with dignified conditions. MSF calls for an end to the Australian policy of indefinite offshore detention. The mental health conditions of asylum seekers and refugees trapped on Nauru is absolutely devastating. Over the past 11 months, MSF teams have treated dozens of men, women and children trapped in a vicious downward spiral of despair. Shockingly, of the refugee patients we treated, at least 78 had attempted suicide, had suicidal thoughts and inflicted self-harm, and they are conservative numbers. Many children suffering traumatic withdrawal syndrome exist in a semi-comatose state, unable to eat, drink and talk. During our time on the island, we witnessed an ongoing significant deterioration of mental health among our asylum seeker and refugee patients. This was very clearly attributable to the indefinite nature of detention, held on Nauru for 5 years, with, for many of them, no resolution in sight, a situation which is in no way conducive to good mental health. The capacity for our treatment to be effective was significantly reduced due to the limitations under which we were working. While many asylum seekers and refugees on Nauru have experienced trauma in their countries of origin or during their journey, it is the Australian government's policy of indefinite offshore detention that has destroyed their resilience, shattered all hope, and ultimately impacted their mental health. 5 years of indefinite limbo has led to a radical deterioration of their mental health and well-being. Separating families, holding men, women and children on a remote island indefinitely with no hope of protection, except in the case of a medical emergency, is cruel and inhumane. Australia's policy of indefinite detention should be immediately stopped. And I absolutely emphasise that it should never be looked upon as a model for other governments to replicate. And to be perfectly clear, MSF is also deeply concerned about the mental health situation of the Nauruan population itself. When MSF arrived on Nauru, mentally unwell Nauruans, some suffering from severe chronic conditions, had not received treatment for at least 9 months. MSF did see an improvement in the Nauruan population during our time on the island, but we are afraid that they will not receive continuity of care, leading to a further decline in their mental illness and increasing again the risk of abuse and neglect. I strongly reiterate, MSF condemns the sudden decision of the government of Nauru to abruptly end MSF's desperately needed mental health care for Nauruan, asylum seekers and refugees on the island. We are extremely concerned for the ongoing mental health of all our patients remaining on the island, including asylum seekers and refugees who remain in a complete state of hopelessness and despair. So now we'll hear from Dr. Beth O'Connor.
So as Paul said, my name is Dr. Beth O'Connor. I'm a MSF psychiatrist and I've been working in Nauru for the last 11 months. I was there for almost the entire length of the project. We were providing healthcare for moderate to severe mental illness for Nauruans, refugees and asylum seekers without discrimination. Amongst the Nauruan population, we had a significant number of patients with chronic psychotic disorders, such as schizophrenia and bipolar disorder. When we arrived on the island, they had not received treatment for the last 9 to 10 months and had relapsed into psychotic episodes. And unfortunately, then they were experiencing significant levels of abuse and neglect, as you would expect when a community does not have the resources to effectively treat severe mental illnesses. We were also treating asylum seekers and refugees, and we had many patients come to our clinic. At the time of leaving, I understand there was nearly 100 people waiting on our waiting list. The conditions that we were seeing amongst the refugees and asylum seekers were mainly depression, anxiety and post-traumatic stress disorder, which was leading to significant levels of self-harm, suicidal ideation and suicide attempts. We were also seeing these conditions amongst children. So amongst the children, they were presenting with depression and anxiety, post-traumatic stress disorder, and we were seeing suicide attempts in children as young as 9 years old. You have to remember that this population of refugees and asylum seekers are a vulnerable group. These are people who had to flee their home country because they needed to save either themselves or their families. They were at risk of death when they left their countries. So they had experienced trauma in their home country, and then they went on to experience further trauma in the migration journey. These refugees and asylum seekers then were placed in detention centres on Nauru, which is not the supportive environment you would want for people who had experienced significant trauma in their past. They went on, both in the detention centres and also in the community in Nauru, to experience further trauma, including physical violence and sexual abuse. There were significant levels of hopelessness and despair amongst the community, which were overwhelming. Over the time that I was in Nauru, we saw a deterioration of the refugees and asylum seekers. In May of this year, there was a significant number of negative responses for the US resettlement process. At that time, over 70 refugees received negative responses, meaning that currently there is no option for them to be resettled elsewhere. They have no hope for where they will go in the future. What we saw in the clinic was that patients who we had managed to have some improvement of their mental health, then with this news of the negative responses, they deteriorated. They generally deteriorated to a point that they were worse than when we started working with them. They deteriorated rapidly, and despite continuing to provide them with the best treatment that we could, it was not enough to improve their mental health, because the indefinite detention for them is remaining. We saw that patients who previously had some life, had some spark, just came into the clinic and their faces were dull. There was a real dullness in their eyes, and I never saw that spark return. I never saw the energy or life for these people return right up until I left. There was further difficulties that these people then experienced since May. There was the devastating effect of the death of a respected asylum seeker in the community. There was then the 50-year anniversary of this policy made by the Australian government in July of 2013. And this is the policy that has led to the indefinite detention of these people. One thing that really struck me was a condition we were seeing in children that we're referring to as traumatic withdrawal syndrome or resignation syndrome. There were children that I knew, because I was on the island a while, children that would stop and chat to me in the settlements or in a shop. And gradually they started to deteriorate. They became more depressed and they withdrew socially. When I went to visit these children at home, they had taken to their bed. They were no longer eating or drinking sufficient amounts to keep themselves alive. Many were not able to toilet themselves. They were incontinent of urine and feces. And when I tried to talk to them, to these children that previously would talk back to me, they would not respond. They would just stare through me. And seeing that level of deterioration in the children was really quite horrific.
Sorry, can you bring the last one just across a bit further, please? Thank you so much. Thank you. Nice one.
Thank you. My name is Dr. Christine Ruffner. I'm an American clinical psychologist. I just returned from working on Nauru as the mental health activities manager for MSF. I fully agree with Dr. O'Connor's statement. I also want to add that we were removed by the Nauru government with the claim that they can currently meet the mental health needs on the island. The Nauru hospital has no psychologists or therapists on staff. There is one mental health nurse who supports Nauruan patients only, and she will continue to do her best. The hospital employs one full-time psychiatrist and that person does not even speak English. She has no translator to communicate with patients. There are no inpatient beds to keep severely ill and suicidal patients safe. Patients have told us that the police have taken refugees who have made suicide attempts to jail instead of to the hospital. Our patients have reported repeatedly being turned away from the hospital after seeking mental health care. This is unacceptable. I've previously worked with MSF as a clinical psychologist on the island of Lesbos in Greece, and with refugee survivors of sexual violence and torture. The significant difference that I witnessed on Nauru is the utter destruction of people's sense of hope. Virtually every patient I met expressed current, intense suicidal ideation, and many had recent self-harm or suicide attempts. The word I heard most often in my own therapy sessions with patients was destroyed. People feeling that their sense of self and any hope that they have about living a meaningful future has been irrevocably destroyed. I heard it in their words, and I saw it in their eyes. One of the most distressing outcomes of this policy of indefinite trapping of refugees on Nauru is that of family separation. Our mental health team has worked with multiple fathers who've been separated from their wives and children for months or for years. Fathers told us, "I wasn't there to support my wife during her pregnancy. I wasn't with her in the hospital to support her while she was giving birth. I wasn't there when my baby took his first breath. I wasn't there when my child said his first words. I wasn't there when my child took his first steps." Every day, these fathers lose the last remnants of hope that they will ever be allowed to meet, to touch, or to hold their own children. Refugees on Nauru have had their hopes and their sense of self shattered and destroyed by this policy of offshore detention. The only solution for these people to psychologically recover from years of exposure to continuous traumatization due to indefinite detention is their immediate evacuation to a stable and safe environment where they can access quality mental health treatment and enjoy the same basic freedoms that all humans deserve. Thank you.
Thanks. So we'll take questions. It's okay, I have a pretty loud voice, I guess you'll pick me up on your mics.
Sorry, Helen Davidson from The Guardian. I know you said that the Nauru government said they felt they could cover the services themselves. That's obviously inaccurate. What do you believe is the reason that the Nauru government wanted MSF with off the island?
I mean, I don't really want to speculate. I mean, that's really for the Nauru government to answer to that. But as we've said, I mean, it cannot be that 11 months ago we reached an agreement that there was a significant need for mental health services on Nauru, and Médecins Sans Frontières, with its background of over 45 years of working, you know, exactly with these kinds of patients, was the ideal organisation to fill that gap, and that 11 months later that gap is now somehow filled. So of course I could speculate, but I would rather not. I think we need to direct that question to the government of Nauru.
Do you believe the government of Australia had any input into this decision, and what did you make of Peter Dutton's comments yesterday about his understanding of MSF just being on Nauru to treat the locals?
Yeah, on the first question, we're certainly not accusing the Australian government of anything, and have absolutely no position on that. I mean, again, it would be a question to take elsewhere. With regards to Minister Dutton's statement, it was surprising that he took a position on what our programme was essentially after the government had declared that this was an issue between Nauru and MSF. But quite clearly he was ill-informed. What I can say is the first page of our memorandum of understanding, categorically spells out with whom we will be providing, to whom we will be providing healthcare on Nauru, and the conditions and purpose of being there, and it specifically includes refugees and asylum seekers.
Josh Butler from Channel 10. On that point, just to sort of follow up on that, what were the sort of specifically what were the services that MSF did, provide to people on Nauru, and what will they be missing out on from now on?
Beth,
yeah. The services that we were providing were that for the Nauruan population, we were working alongside the minimal mental health staff they had, which when we left it was only one nurse and a psychiatrist who doesn't speak English. So we were aiming to work towards capacity building for them and treating those patients. We were also doing health promotion work because amongst the Nauruan population they have they can recognise severe mental illness, mainly psychotic disorders, but they don't have much of an understanding of conditions such as depression and anxiety, and there's a lot of stigma about mental illness as exists in most places in the world. So we were working towards addressing that, and that work is unlikely to continue without our presence there. In terms of the refugees and asylum seekers, we were offering care in our clinic, and we were the only independent organisation there. The other services that are provided to them are contracted by the Australian government, which obviously with mental health, people really need to trust the practitioners that are treating them, and if you fear that the practitioners who are treating you are associated with the people that are determining your future in regards to immigration, then you're being that does disrupt that therapeutic relationship. Was there anything you'd like to add?
Olivia Bruce from Background Briefing. I was wondering if you could tell us what impact MSF's absence from the island will have on the evacuation of critically ill patients through the federal court process.
In terms of evacuating patients, what our role in that was we were providing patients with a summary of their condition and psychiatric or psychological opinions, and we were giving those to patients. We do know that those patients were giving those to lawyers, and that some of our records did end up in the federal court. The process of children and adults with both mental and physical illnesses being transferred off Nauru is complicated. There is a lack of independent opinions, and that is problematic. So yeah, it could affect the amount of people being transferred. But yeah, sorry.
Yeah, I mean, I would add, it's our responsibility to answer to requests of our patients. So this is not something that we're doing as an initiative of ourselves, but sure, if a patient asks for an opinion on the medical condition, we will give it to the patient. What they do with that, of course, is up to them. But the point being, yeah, we were the only provider providing an independent medical opinion, at least in their eyes.
Were you ever approached by Nauruan or Australian officials about those reports ending up in the federal court cases through the lawyers? But did anyone ever express displeasure at that happening?
No, it's never been redressed with us, if you like, or stated as a concern, or certainly not expressed as a reason why we're no longer on Nauru. It's not been expressed to us.
But do you think it may have been a factor?
Again, we're getting back to the original question, to speculate around what's driving Nauru to make this decision. I mean, within 24 hours to remove health services, when our memorandum of understanding has a mutual agreement that we will give each other 3 months' notice in order to be able to appropriately wind down and hand over a program of this kind of complexity. So again, I don't want to get into the speculation. It could be, but that's not for us to say.
Can you give us some idea about the breakup of the work that you were doing for asylum seekers versus the general population? And what sort of ratio are we talking about? How is it divided? Just a very rough idea, obviously, because if the government did say yesterday that your main purpose was to serve the general population, it's just helpful to get an idea of how much work you were doing with asylum seekers versus the general population.
I think roughly the breakup, I think we're probably seeing about sorry, because I wasn't.
That's right.
Yeah, just the exact numbers I can't really remember. But we were seeing significant numbers, both of Nauruans and refugees and asylum seekers.
Would you say you saw
that.
more Nauruans than refugees and asylum seekers?
We'd have to get back to you with those figures, sorry.
What we would say is that, you know, initially we saw a lot of Nauruans when we started, but as our presence became known, our services became better known, and it's largely, you know, word of mouth, and our health promotion activities were successful. The demand and the increase that we saw was very much among the asylum seeker and refugee population, and we were also handed over a cohort of patients and Nauruan patients who were, you know, in one way or another already registered under the care of the Department of Health, because we were there to provide those services. So we had an immediate caseload, if you like, to work with, but that balance shifted, but exact numbers, yeah, we could always get back to you.
So I'll ask Dr. Raffner, when you compare how refugees were being looked after on Lesbos and Nauru?
I think it's always difficult to compare human suffering. As I mentioned, the main difference in Nauru is the length of time people have been there. When I was in Lesbos last year, people still had a sense of hope. People were moving to the mainland. People were spending months on the island at that time. The context has changed quite a bit since I was there last, so I hate to compare what's happening now to what I've seen, but this element of time, of slowly over time taking away people's sense of hope that they will ever have freedom to live the lives that they want to live, a life where they can take care of their children, where they can engage in education, engage in meaningful work. That is what's missing and has been missing for a long time on Nauru, and that is the most difficult thing that I saw there.
How damaging is it from your professional opinion for people with quite severe mental health needs to then have those services taken away within 24 hours and without being able to do the appropriate handovers like you were assured you would be able to?
It was extremely difficult for us. We received notice at 7 p.m. and we had till noon the next day to close everything, to make sure that we were doing our ethical obligation to take care of the patients we were seeing. So we worked through the night to try to gather the information we needed, but it was really hard for the team. Very difficult, and we're unsure how our patients are going to be managed now on the island.
Did you manage to, obviously this is probably a silly question, but did you manage to do an appropriate kind of wind down, and what are your fears now that MSF is not on the island? Like, are you worried that things will rapidly deteriorate even further now?
I mean, I would say absolutely not. I mean, you can't wind a program down in a couple of days. It's absurd. You simply cannot do that. And yeah, it's medically irresponsible to try. That would not have been the way MSF would have at all gone about relinquishing its responsibilities for the healthcare of a population. We don't do that anywhere in the world. So no, it's certainly it's not adequate. But under the pressures, of course, we've done everything we can. But what's quite clear is you know, the process itself was intended to ensure that we had relinquished all responsibility towards those patients. Yeah. Yeah.
Yeah, and I think in terms of prognosis, we have been seeing people declining. I saw deterioration of mental illness over the 11 months that I was there, with significant hopelessness and despair. There is nothing to suggest that that will stop, and we believe that it will just continue to worsen until everybody, all the refugees and asylum seekers, are removed to a place where they're in a safe environment.
And sort of a follow-up there, like these are people who talk about being, feeling forgotten and, left behind and that sort of thing. Do you feel like the abrupt nature of the withdrawal might even be a huge factor in itself, just in isolation?
Yeah, as a clinician, you build up therapeutic relationships with people, and they trust you over time. And these are people who it's been hard for them to trust people because of the nature of how they've been treated. It's been 5 years on the island of not being told what's happening, being given incorrect information, and the fact is that they're still there. So there was a significant amount of work in order for these people to be able to build those relationships with us and trust us. And we were the only independent organisation. There had not been any other independent organisation on the island. Everyone else was contracted by the Australian government. So yes, we think it's very damaging to people, the refugees and asylum seekers, and we just hope that there will be no deaths as a result.
A number of members of the Australian government have said that IHMS is there as a contracted health provider, that the level of service and resources they have is constantly reassessed. Do you have any confidence that them being the only remaining provider of mental health care on the island is adequate?
As Beth just stated, they're contracted by the Australian government. So for patients to go there and feel safe, to be completely honest about what they're experiencing, to share with sort of your captor your concerns, a branch of your captor, it's not an environment that could lead to a therapeutic environment, an environment of recovery, an environment of trust. I don't believe it's possible.
So be clear, we don't dish the medical standards that IHMS take to the island, but yeah, it's a question of trust and a question of perception, information sharing, the history, and that's something that we were bringing was uniquely different, that we were independent, as we are everywhere around the world, and through that we had a growing cohort of patients, a rapidly growing cohort of patients. And although our medical care in and of itself was not the solution, because their healthcare continued to deteriorate because of the underlying drivers creating this trauma for them, at the end of the day they still came to us. There was something important for them in our presence on the island, without question, that will not be replaced.
Can you describe your relationship with the Nauruan government and other officials over the course of that 11 months and sort of how it started and how it deteriorated? I know there was an incident with the house lease related to the Nauru 19 as well. That's been suggested that was possibly a reason. Maybe you can talk to us about the relationship.
Yeah, maybe I'll just say in general terms, because I mean, it's not been an easy relationship. I think the very idea of us being there and treating asylum seekers and refugees as well as Nauruans was not accepted by all. I mean, it was clearly agreed, cabinets met twice and ratified this agreement, but it wasn't necessarily widely shared. So we found that there were many obstacles. It was difficult to collaborate, it was difficult to share information in the interests of patients, it was difficult to get access to everywhere we would have liked to have gone. Particularly in the interests of individual patients who might have been in, at a severe and high-risk moment. Yeah, we had logistical problems too. It's a very small island. It's very hard to get to for example, have accommodation, and so even basic things were constantly challenging. And it's an environment where we were also the only independent organisation. In many other environments there'd be a number of those. So there was a significant divide. I think we felt quite isolated for many reasons while we were on the island.
And maybe I could give some examples. So how that affected us with our clinical work. There were incidents where we were reviewing patients in the hospital. I recall one incident where I was reviewing a child who had made a suicide attempt, and at that point they were asking me to provide a substitution service because they did not have any other doctor under the Nauru hospital who was available to do that. And during this consultation with this family, I was interrupted by a government official from the Nauru government and told to leave. And there was no other option provided of who was going to do that assessment or when that psychiatric assessment would occur. And obviously I have an obligation to patients, and ended up having to try and sneak the details of our clinic to this family so that they could later come and see us for assistance. But as a doctor, it's a very bizarre situation when you have to kind of sneak information to patients about how to seek healthcare because a government official has decided that you should not be seeing a refugee.
How many staff did you have on Nauru? And were you, I suppose, were your visas cancelled? Were you forced literally off the island, or was it more of a case of, okay, our work here cannot continue, so we're leaving now?
I'll leave you to answer on staff because I'm not across staff numbers, but yeah, I mean, we invested time in trying to renegotiate. One initial idea was to bring a commission, of senior responsible people within the organisation to meet and try and hash out what the reasons were, etc. But we never received a response. We've been finding it increasingly difficult to work over the past weeks and months. Anyway, we haven't had visas renewed for team members for quite some time, and we were very worried that if we didn't get them, we would be in a position where we wouldn't be able to continue to operate. Anyway, we were finding increasingly we were being blocked to travel in the way we had become accustomed to outreach into settlements, for example. And we were finding it very hard to actually have discussions with our counterparts. So that was the context that we were in when this this happened. Yeah, and then on staff numbers.
So in terms of staff numbers, we had in the clinic 2 psychiatrists and a psychologist. We also had a mental health activity manager, who most recently was Christine, and she's a psychologist. We also had 2 translators and a health promoter. And then we had our field coordinator and a staff member who was responsible for the administration, financial and human resources needs of the project. We also employed local staff for various roles, and that was both Nauruans and refugees.
Incidentally, visas were cancelled on departure for our team. It has been made categorically clear that there's no intention of inviting us back, at least at the moment.
How common is it for MSF to be kicked out of a place? Are there examples of that happening elsewhere in the world recently that you would say are comparable to this incident?
It's very, very unusual. We tend to talk about it as a risk in highly insecure or very, very difficult contexts, highly challenging contexts. But it's actually very unusual, happens very rarely, particularly where we have very clear legal agreements and legal frameworks. There's no question of whether we were we had an agreement to be there or not. So in that, under those kinds of circumstances, it's very, very unusual that within 24 hours you would be asked to pack up your services, and the reason for that would be because there was adequate, an adequate provision. You're no longer required in the space of 11 months. That's I'm trying to think of an example, but I can't, to be honest. No.
Going back to your call for an end to offshore processing and the impact that that ongoing detention is having on people's mental health, quite often this debate sort of hits a wall when the government says people are no longer in detention. They've got everybody out of detention. It no longer applies. People are free to move around. What's your response to that? I mean, I know it's, that you called it detention, you called it something else, but what's your assessment of that claim by the government?
Well, we're talking about an island that you can drive around at 40 kilometres an hour in half an hour. So we're talking about a very small place for these people to be, and maybe they're not detained by a fence, but they're detained by the ocean. And I think they don't have freedom, they do not have passports, they cannot leave that place, and that for me means that's a form of detention, and they don't have many opportunities available to them. There's not many opportunities in regards to education for people on the island, not many work opportunities, and they do not have the freedom to be with their family members. They've been separated from their family members and they remain separated from their families. So yeah, I do think we can call it that, their freedoms.
Yeah, I mean, the way we look at it is we would say they're essentially trapped, I don't want to get into semantics, but they're trapped, and they do not have a choice over virtually anything for themselves. So, yeah, to all intents and purposes, that is a form of detention, and we see, the significant deterioration of their physical and mental health directly as a result of that. I mean, that's our medical opinion.
Just back to the issue, do you have any idea how many cases have actually involved health records provided by?
No, I'm not. I'm not privy to that information. I suppose that's something you'd have to ask the Australian Federal Court.
Yeah, I mean, I reiterate. We're not involved in those cases per se, but we might be requested to provide a medical opinion by one of our patients. What they do with it, that's a process that we're not engaged in. Yeah.
Would you know how many times you've provided those sorts of reports to patients?
We've provided records to patients when they ask, because that's their right. They have ownership of their records. So we have provided it when they've asked, but I'm not sure how many times. And we don't know when they ask whether that just stays with them or whether they then hand it on to a third party. We're not privy to that information.
Thank you.
Thank you. Thank you very much.
Thank you for helping us with the microphone. Very nice.